Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
My name's Ali Danani. I'm a physical therapist here at Advent Health Wesley Chapel, and I'm here to talk to you about common running injuries. As I said, I'm a physical therapist here at Advent Health Wesley Chapel. I've been providing rehab to athletes since 2009, certified in mechanical diagnosis and therapy, a board-certified sports specialist, and also a certified athletic trainer. A lot of people run per year. More than 20 million people run regularly every year, and this number was taken in 2018. That number is probably much higher to date, and at least 60 million people are running at least once per calendar year. There are many benefits to running: musculoskeletal health, body composition, cardiovascular health, and psychological health. Unfortunately, with these benefits, there's also an associated risk. And it's predicted that at least 50% of runners report injuries every year, and about 80% of those are due to overload or overuse. These are all the tissues that are affected in running. There are more tissues than this, but these are the main musculoskeletal ones. And so I want to describe what overuse really means. Overuse is too much, too fast, too soon. This can also be created by abnormal stresses, and we'll go over what that means a little bit later. Our body needs balance in order to heal. The loading from running has to equal healing. If it doesn't, we can end up with overuse injuries. Loads that our body feels are tension, compression, and friction, and we'll go over a little bit more of that later on. Load has to equal remodeling or healing. When we run, every time we hit the ground, that's considered a load. If that equals the healing potential, we have no issues. If it's less than the healing potential, we inhibit performance. If the load is greater than the healing potential, we end up with overuse injuries. This is an example of what happens to a tendon when we overuse it. If you look at the slide for the healed tendon, you can see all the tissue is aggregated, it's aligned, all the fibers run parallel to the load that's placed on it. When you look at the tendon next to it, this is what a tendon looks like when it's overused. So every time we exercise, we create mechanical stress to that tissue. That tissue then leads to healing. When we overutilize it, your body will end up laying down type 3 collagen specifically for the tendon. That's an immature collagen within this tissue. This tissue is less organized. It has more vessels and nerves. This is to make it painful, to tell you to stop doing what you're doing. This process is a protective response, and it's time dependent, and we'll talk a little bit more about that time as we go on. These are some of the stresses that our tissue and joints feel. We have ground reaction forces, and this follows Newton's third law. And basically this means every time you hit the ground is hitting you back. The harder you hit the ground, the harder it's hitting you. And it's estimated that about 2.5 times your body weight is felt through your joints as you run. And this can go up if you're doing hills. This can go up if you jump, if you run faster. So this is kind of the base amount that your body feels. You'll also have additional stress if there are mobility or stability deficits. And we really want this tissue strain to be as low as possible while we're training. This will help prevent injury. So common overuse injuries that runners face, this is specifically to fascia. We have IT band friction syndrome and we have plantar fasciitis. You'll also hear it as plantar fasciosis, plantar fibromatosis. With IT band friction syndrome, if you look at the picture on the top right of the screen, up towards the hip, there's a big bone that sticks out. It's called the lateral trochanter. You have the IT band, which is the fascia that runs down the side of the leg. As you flex and extend the hip while running, that IT band runs over top of that bone. This can create a friction problem that can create pain. If we have improper alignment or improper stabilization, this can exacerbate this problem. With plantar fascia, if you look at the bottom picture with the foot, the plantar fascia comes and attaches to the base of the great toe, the first toe, and it comes in and attaches to the heel and has an attachment to the Achilles. Its role, as you go through toe off during walking, is to stabilize the foot and the arch so you can propel yourself forward. As the arch drops, or if you perform this role too many times, you can create an overuse injury with this as well. Musculotendinous unit, we talked about what happens with the tendon. This is very common in the Achilles, the patellar tendon, and the hamstring tendon. Achilles is obviously down towards the ankle, patellar tendon is in the front of the knee, and hamstring is in the back of the knee. We also have the tibialis posterior tendon, and you can see in the picture of the foot, this is one type of shin splint that we can get. Similar to the plantar fascia, it comes to support the arch during toe off or propelling yourself. And we can create this same type of tendon issue there. If you follow that tendon up towards the shin, you can also get a tendinopathy in this area where it pulls at that periosteum of the bone or the outer lining of the bone. So again, this is one type of shin splint that we can experience. If we let these tendon and soft tissue injuries go, typically they will develop into a stress fracture. If you end up with a stress fracture, depending on the location, you'll most likely end up in a boot like this. Stages of healing are extremely important, and this is where that time dependency comes from. Inflammatory phase, 2 to 5 days, and depending on who you read and what you read, this time may change a little bit. If you develop symptoms, immediately shut it down for 2 days. Let's see if that goes away. Once we get into the proliferation phase, this is where we start to lay down some of that immature collagen, that type 3 collagen in tendons. Once we get into this phase, this is typically where some type of intervention is needed. This is where we need to seek out care to make sure that we heal properly and prevent this from becoming a chronic issue. Once that tissue is laid down, then we get into the maturation phase. This can start anywhere from a few weeks to 6 weeks, all the way up to a year. Once we get into this maturation phase, that's when scar tissue starts to present, and that's where it becomes just a little more difficult to resolve these issues. How do we treat these? The first thing is prevention. We want to make sure that it doesn't happen. This is slowly increasing the volume of work, slowly increasing the speed, being mindful of inclines and declines. This sharply increases the stresses that are placed on the tissue in the body, changing shoes often, eating the proper nutrition and staying hydrated, and then recovery, rest, and sleep. Nutrition and recovery are probably the two most undervalued aspects of training, but extremely important. Early recognition is the next piece we talked about in the inflammatory response. If we find it the first 2 to 5 days, we rest it, get rid of it, fix maybe shoes, and a lot of times that can resolve the problem. If we can catch it after the inflammatory response, before 6 weeks, we can usually get this feeling better pretty quickly. After 6 weeks, we start to develop scar tissue, and then this takes a little bit longer to fix. We always want to correct the deficits. This is the alignment, so shoe inserts, changing the proper shoes. That's a little bit out of the scope of this presentation to talk about that, but extremely important. Mobility, making sure not just the flexibility, but also the joints are moving properly. And then stability, and we'll talk a little bit more about the stability here in a few minutes. Once we get past that 6 weeks, then it's essential that we remodel that grade 3 tissue, remodel the immature collagen back into that type 1 collagen. This is performed through specific loading, and it depends on what tissue is damaged and how we load it. We can do this either through stretching or strengthening. And there's a very specific response you should feel while you do this. Now I'm going to introduce Josh Heron, and he's going to talk about some of our warm-up, cool-down, stretching, and strength considerations for running.
Hi, I'm Josh Heron. I'm the fitness supervisor at the Wellness Center, Advent Health Wesley Chapel. So Allie gave us a great amount of information, and you're probably thinking, how can I translate that to my life? So basically what we're going to do is go over what it means for you. Go over some proper warm-up and activation, proper cool-down, some stretching to prevent your injuries, and some strength considerations as well. So before you run, a lot of people like to just go out and, I'm just going to go out for an easy run. There's actually a few things you should do to actually prevent injury. One of those things is called myofascial release. So what does that mean? It's basically using an implement to apply pressure to a muscle to inhibit an inhibition response. Sometimes you can use a lacrosse ball or a foam roll, and then the direct pressure from these implements will actually cause the muscle to relax. That will allow your dominant muscles to kind of take over instead of having your smaller muscles work harder. Another thing we should do is it's called an active warm-up or dynamic stretches. Some of these include glute bridges, some bodyweight squats, some toe crunches. Basically, all you're trying to do is supply the muscles with blood and make sure they're nice and warm before you actually get into your running. Another component of the running program should be your cool down. A lot of times this gets neglected as people don't usually have time or they don't think it's necessary. The easiest way to complete this is by steady state walking. So just walking after your running program can help you clear waste, reduce inflammation by maintaining an exchange rate of blood between your lower limbs and your heart while not accumulating additional lactic acid. Clearing the waste helps you reduce the risk of muscle and tendon adhesions brought on by pooling lactic acid, which can help you reduce your risk of injury. This also helps you recover faster by keeping that high blood flow rate, but not actually stressing your tissues. So some post-workout stretching considerations are your plantar fascia, your IT band, hip flexors, and abdominals. Some strengthening considerations. So your glutes help to reduce your knee pain by transferring those forces up from the ground to your larger muscles of your body instead of into your joints. Your anterior tib, which is a long muscle that goes along the front of your shin, helps to create a better longitudinal arch in your foot, which can also reduce another risk of shin splints and plantar fasciitis. Here at Advent Health, we have an AlterG, which is an anti-gravity rehab and training tool. It allows users to unweight themselves in various increments and provides controlled progress of the weight-bearing activity while reducing the impact of injury. You can contact us here at 2700 Healing Way, Wesley Chapel, Florida. And our phone number is 813-929-5252, or for outpatient rehab, 813-929-5407. So a lot of times I get asked, what are the most important stretches for runners? This obviously depends on your level and frequency, but I think a couple of the most important stretches are for your IT band, which is the band that runs along the outside of your leg and crosses in your knee, and also for the plantar fascia, because those are the two most common injuries I think we see today. I've also been asked, what are some great strengthening exercises for runners? For me, it would be definitely strengthening your glutes, as your glutes can help take pressure off your knees and your lower body by becoming a shock absorber and transferring those ground forces throughout your body. Also, I would recommend strengthening any muscle that creates an arch in your foot. So basically, those are the front of the shin muscles, and anytime you do a toe crunch and create an arch where the middle of your foot raises off the ground.
So running distance and time is very specific to the individual. It all depends on the training age, how often that individual person runs. Typically, you can read some articles that will say you should increase your volume by 10% per week. I more so like to go by a symptom response. If you're able to slowly increase it at the pace that you're increasing it and you have no symptoms, then that's typically fine. If you increase it by 10% and that bothers you or you develop some type of pain, then you may have to decrease it. But that's a very specific question per person, per situation.